My name is Dr. Adrian Malik. I am 68 years old and I have spent more than 4 decades caring for aging bodies and listening to aging hearts. What I am about to say may feel uncomfortable, but it comes from years of sitting across from men and women who quietly wonder why they look so much older and so much more unhappy than they feel inside. Aging itself is not ugly. It is honest. It is natural. The lines on your face are not the enemy, and the silver in your hair is not a failure. What truly changes how an older person looks is not the number of birthdays they have celebrated, but the habits they carry into those later years without realizing the effect those habits have on their face, their posture, their voice, and their spirit. I have seen 80-year-olds who glow with warmth and presence, and I have seen 60-year-olds who seem to have already surrendered to life. The difference is rarely medical. It is often behavioral, it is subtle, and it is correctable. One of the most damaging habits I see is the constant rehearsal of complaints. As we age, discomfort becomes more common. The knees ache, the back stiffens, sleep is lighter. These are realities, but some people begin to organize their entire identity around these discomforts. Every conversation becomes a report of pain. Every visit with family becomes an inventory of symptoms, and slowly the face begins to carry the weight of chronic dissatisfaction. When a person complains constantly, the muscles of the face tighten in predictable ways. The brow furrows, the jaw sets, the corners of the mouth turn downward even at rest. Over time, these expressions become the default setting. The nervous system also stays in a mild state of stress, which affects skin quality, sleep, digestion, and even immune function. Chronic negativity is not only socially draining, it is physiologically aging. I am not suggesting that pain should be hidden or that illness should be ignored. I am saying that when discomfort becomes the center of identity, it reshapes both appearance and relationships. People begin to withdraw. Invitations become fewer. Isolation grows. And isolation, more than wrinkles, is what makes a person look truly old. Another habit that quietly ages people is neglecting posture. I cannot tell you how many times I have gently placed my hand on a patient's shoulder and asked them to sit upright. Years of leaning forward over phones, televisions, or simply over the weight of worry cause the spine to curve. The chest collapses inward. The head moves forward. This posture not only signals fatigue and defeat, it also affects breathing capacity. When the lungs cannot fully expand, oxygen delivery decreases, energy drops. The skin may appear dull. The voice weakens. Confidence seems to evaporate. A stooped posture tells the world that you are withdrawing from it. It also tells your own brain that you are less capable because body language influences internal chemistry. I have watched patients regain a surprising amount of vitality simply by strengthening their back muscles, opening their chest, and learning to walk with deliberate steadiness. Then there is the habit of emotional rigidity. Many older adults develop a fixed narrative about how the world should be and how younger generations must behave. When reality does not match that narrative, frustration builds. The face tightens again. The eyes harden. Conversations become arguments waiting to happen. I understand this deeply. Change can feel disorienting, especially when you have lived long enough to see the world transform several times over. But resistance to every new idea, every new technology, every new cultural shift creates a constant state of irritation. That irritation shows. It sharpens the voice. It reduces laughter. It narrows social circles. Flexibility, even in small ways, softens the features. Curiosity brightens the eyes. When an older person asks a grandchild to explain something, rather than dismissing it, there is an immediate warmth that appears on their face. Another common and unfortunate habit is neglecting basic self-care under the belief that it no longer matters. I have heard patients say, "At my age, what is the point?" They stop caring about grooming. They stop choosing clothes with intention. They skip dental appointments. They allow small health issues to linger untreated. This quiet resignation accelerates visible aging. Poor oral health affects facial structure and nutrition. Untreated hearing loss leads to social withdrawal and cognitive strain. Dehydration, which is extremely common in older adults, makes skin appear thinner and more fragile. Small daily decisions accumulate. The body responds to care at every age. It also responds to neglect at every age. There is also the habit of social withdrawal disguised as independence. Many elderly individuals tell me they do not want to bother their children or burden their friends. So they stay home. They decline invitations. They reduce their world to a small and predictable routine. At first, this feels safe. Over time, it becomes shrinking. The human face is animated by interaction. Conversation stimulates micro-expressions. Laughter increases blood flow. Eye contact maintains cognitive sharpness. When social contact diminishes, the face can appear flatter, less expressive, almost guarded. Loneliness has a distinct look. It is not about wrinkles. It is about absence of engagement. And then there is chronic comparison. Some older adults compare themselves relentlessly to their younger selves. They look at photographs from 30 years ago and measure every change as loss. They compare their current energy to what it once was. They compare their memory, their stamina, their physical attractiveness. This constant internal comparison creates disappointment that settles into the body. Shoulders slump. Smiles become rare. Yet aging is not a competition against your former self. It is a continuation. The body at 70 was never meant to be the body at 40. When acceptance replaces comparison, something extraordinary happens. The face relaxes, the eyes regain kindness, peace is visible. Finally, one of the ugliest habits I witness is the refusal to forgive, whether it is forgiving others or forgiving oneself. Decades-long resentments carve deep lines in the face that no cosmetic procedure can soften. Holding on to anger keeps stress hormones elevated. Blood pressure rises, sleep suffers. The mind replays old injuries as if they are current. I have sat with patients who carried a sibling rivalry from childhood into their 70s. I have listened to widows who never forgave themselves for decisions made in youth. The emotional burden was visible long before they spoke. When forgiveness finally occurred, sometimes after years of gentle counseling, their appearance changed in subtle but undeniable ways. The jaw unclenched, the eyes softened, the voice steadied. You may notice that none of these habits are about expensive creams or surgical procedures. They are about daily posture, daily language, daily emotional choices. Aging is inevitable. Looking defeated is not. Looking perpetually irritated is not. Looking disengaged is not. In my practice, I often tell my patients that the most attractive quality in an older adult is not youthfulness. It is presence. Presence in conversation, presence in self-care, presence in the willingness to adapt, presence in kindness toward oneself. When an elderly person maintains upright posture, speaks with measured calm rather than constant complaint, stays curious about the changing world, tends to their health with dignity, engages socially even in small ways, releases harsh comparisons, and practices forgiveness, something remarkable occurs. They do not look younger in a superficial sense. They look alive. And aliveness is what we are truly responding to when we say someone looks good for their age. We are not measuring the smoothness of their skin. We are sensing their engagement with life. If you are listening to me now and you recognize one of these habits in yourself, do not feel shame. Awareness is the first shift. Habits formed over years can be gently reshaped. The nervous system is adaptable. Muscles can be strengthened. Conversations can be redirected. Apologies can be made. Invitations can be accepted. I am 68 years old. I wake up with stiffness some mornings. I notice changes in my own energy. But I also make deliberate choices. I stand tall even when it requires effort. I limit how often I speak about minor aches. I ask younger colleagues to teach me what I do not understand. I drink water before I feel thirsty. I call friends instead of waiting for them to call me. I practice letting go. Growing older is not a cosmetic problem. It is a behavioral journey. The face reflects the life being lived behind it. If you want to look less old and less unhappy, begin not with the mirror, but with your habits. The mirror will follow.